welcome to VistaTalks, interesting discussions with interesting people from all around the world. I am your host for today, María Roa, and I am thrilled to welcome Jamie Whysall, the head of health at Netcompany UK, to our podcast. Jamie has been instrumental in driving digital transformation within the healthcare sector, leveraging innovative IT solutions to enhance patient care and operational efficiency. With a wealth of experience and a passion for healthcare innovation, Jamie is here to share his insights about digital health and its future. Jamie, welcome to the show.
Welcome. Thank you, Maria.
Well, your career spans multiple industries from financial services and retail to defense and healthcare. Can you tell us more about, everything you did, but specifically about your role as head of health for Netcompany?
Yeah, sure. So at Netcompany, we work with a whole range of healthcare ecosystem partners, from hospitals to national bodies to social care and health tech organisations. We particularly help them, and I use the term joining the dots. Those organisations operate and have lots of data, lots of information around what they're doing in terms of their operation, and the work that they're doing with citizens and patients. And we work with them to advise them, to support them with opportunities to bring those data points together, to link those systems up. We share our experiences that we've had across Europe. So, Netcompany, as a Danish company, has a lot of experience in digitalization in many industries, and we bring experiences from healthcare verticals in other countries, from other industries to the healthcare sector, and our experiences of working with the different parts of healthcare to help them understand what the art of the possible might be. One of the founding principles of Netcompany is the concept of reuse. We don't like to develop solutions and then go and develop the same solution again in a different context. We like to lift and share that IP, that experience, that knowledge to accelerate other deliverables, particularly when we're talking about healthcare in a public context where it's funded by government and public sector organisations. Why should a taxpayer in Denmark or in the UK pay to develop the same solution over and over again in different contexts? That reuse is really a core principle of Netcompany.
Wow. I like what you say about joining the dots because that basically is like helping companies.
Yeah.
And I feel in a way that's the same thing we do, obviously in a completely, different side of the business. But I think that's what what companies should always be doing, helping
Yeah,
other companies to get their goals. And that's what we are all doing.
absolutely.
At Netcompany, you work with a wide range of organizations in the health ecosystem. What are some of the ways Netcompany works with them across their digital transformation journeys? Because digital transformation is huge now.
Yeah, and we Netcompany has a term of digitalization as opposed to digitization,
Hmm.
and we work with organisations to help them take advantage of the role that digital can play in changing their business model. This isn't about just putting a system in that replicates the analog process and digitalize it, and we see that a lot in healthcare situations where, there's a point solution that's deployed that effectively just replaces, a small part of the journey with a digital solution. And yes, that might make that journey faster. But for us, our work is about, well, actually, is there a way to reimagine that process, and can digital, change that journey on its head, and make the end-to-end piece faster or more efficient or more effective or drive a better outcome. That is really what Netcompany see as digitalization as opposed to digitization, and there's a key difference in the word that we use.
Hmm. Okay, and everything you keep on saying everything is kind of different, like you custom make those solutions for everyone, right?
So so customers have a choice, customers typically think they have a choice. If you want a new system, you go out and buy something off the shelf that
Okay.
probably 80% right, and then you spend 20% of the effort customizing it. Or you go out and you buy something that is, you build it bespoke to yourself, and that's got a very heavy cost up front, but perhaps a better ongoing kind of cost base because it's something you developed and you haven't got kind of the licensing and such like. At Netcompany, we like to think there's something in the middle where actually you start with building blocks that have been bespokely built for other public sector solutions, but they maybe get you 40 or 50% of the way there, but that allows you that greater level of customization in terms of making a solution that's fit for your organization or your context. And then that allows you to then have the benefit of no kind of ongoing licensing, in terms of being tied to a particular platform. It gives you a more modular IT setup and
Oh,
architecture that allows you to potentially take some of those components out or augment them with other components as technology develops going forward.
that's super interesting because I guess it also saved them money somehow,
Yeah,
right? I mean, so that's amazing. Well, at the end, I mean, technology is playing an increasing role in shifting healthcare from reactive to proactive, particularly in personalized, sorry, uh, preventive health. Can you share some real world examples of how technology is enabling this shift?
yeah, and I think what we've got here in particular is kind of the convergence of consumer health tech along with medical devices. So pretty much everyone now wears devices on their wrists that monitor all kinds of things around your health, and that's driving a sense within the population to kind of take more interest in their health and their stats and such like. I think what we're starting to see, and all healthcare systems, and obviously I'm particularly attuned with the UK one, are trying to work out how do they shift from reactive to proactive healthcare. And there's a period of time, probably over the next 5 or 10 years, where systems are going to have to do both of those things in parallel, because in order to become proactively, you've got to start making interventions that aren't going to have a payoff for maybe 5 or 10 years' time. But you're still going to have those healthcare episodes that present themselves through the fact that we haven't prevented it, 5 or 10 years ago. Um, the consumerization of tech and the kind of convergence of those two technologies where the types of devices that you've got on your wrist start to be classed as medical devices and can start to take that data and then be able to bring that to a healthcare professional that allows them to then start to remotely monitor, screen, or cohort individuals, I think is where we really start to be able to get into that proper reactive to proactive shift, because the proactive nature requires clinicians to make an intervention or citizens to make an intervention in their own healthcare experience, be that losing weight, reducing blood pressure, increasing activity, or drug interventions or whatever that might be. But in order to do that, you need to have the data. And that data at the moment, I don't think is quite there in terms of being at the fingertips of clinicians around the world.
Mm. You're so right because, for instance, I mean, there's this thing. I just bought one of these new. básculas that you can weigh yourself, and then it will
Yeah.
tell you absolutely everything, every data. I mean, I used to have an old
Everything
one
you
that
don't want to hear.
I know exactly. I used to have an old one that it would just tell you your weight, but then this one, you just tap on it and it tells you absolutely everything in an app on my phone
Yeah.
that I don't want to hear, as you're saying. But then when I read it, each of the things that it's telling me, it's also letting me know how I can make it
Yes.
better, which
Yeah.
is really nice because there are things that I had no idea. Some of them are just like, in order to get this down, you really need to drink a lot more water. You should walk more, which you know, but you're like, oh, but it's really high. Maybe just walking a bit more, it will help. Just, these little tips. And I feel like this would be very helpful to take to my GP next time and tell
Mm.
him, I know this bascula probably is not, the most efficient or the one that it's giving me the best data, but you have all this data. What can you do with it?
It gives you a trend, and it also kind of empowers you to make those small changes and then see the impact of those changes.
Correct.
So it kind of, and I think particularly in a public healthcare context, where actually you making those small changes could actually save thousands and thousands of pounds for the healthcare service at some point in the future. Being able to um, raise that up at a population level has the ability to save millions and billions of pounds or dollars or euros or whatever currency you want to refer to in public healthcare, in terms of driving that agenda. And I think that's the grasp that healthcare
Yes.
systems need to work out. Well, how do we make this work? And it's really augmenting that data with the clinical data that is held, and then allowing clinicians to use that and use that to then help citizens like you and I to make those changes in our daily lives.
Yeah, 100% agree. I think it would be really, it's super useful information. And at the same time, it is pushing me to try to make some little changes that I think it might do some good to me. So I feel this could help so many people, like even
Mm.
older people, like my parents or something, if they really did see, like this trend, like you say, because it's one day after the other, and then you see what type of things, well, anyways, it's really complicated, but like whenever you eat something, maybe you see one of those numbers really go
Yeah.
up, one of the others, and then you're like, maybe next time. So you learn to take care of yourself somehow. So all this information, all these digital companions that
Yeah.
we have on our hands are very important, and it would be great that we could get the healthcare companies to have this data somehow and
Yes.
help us.
Yeah.
So thank you for that. That was very interesting. I had not thought about it that big, but yes. Um, let's talk about quality now, because I guess also the quality of data and the quality of
Mhm.
everything, but the increased quality and obviously transparency is critical for the success of providing elevated healthcare service for citizens. Do you have any interesting case studies that you've been seeing or work well, or that you think that have worked well across Europe?
So for this, I'm going to reflect on some of our Danish experience. So
Okay.
in Denmark, we've been involved in effectively their digital health portal. So this is um, a kind of a citizen-facing website that basically holds all of your individual health data, and you can log into that and you can see everything about your lifetime, your healthcare journey. And the exact number escapes me, but I think anyone born after something like 1981, their entire healthcare history is available in that portal. And 96% of the Danish population are registered to use it. And the level of empowerment that gives to the citizens is really tangible in terms of them taking control of their healthcare, but also in terms of ensuring that data quality and that shared data knowledge. Because ultimately, if there is a mistake in that data, by exposing that data to a citizen, they can query that at the time that it gets presented to them, oh, that doesn't feel right. You haven't captured a condition I told you about, because of, there's a manual process between the clinician hearing it and them transcribing it into the system. Or, oh, actually, I didn't know about that, and it allows them to question that record. Now, what's really important there is also which we've done within the Danish solution, is to enable the dialogue to happen digitally. So instead of I see a problem, I now need to go and make a GP, and that puts extra burden onto a GP to go and correct that. The ability to be able to, through that portal, message your GP and say, oh, I've got a query about this data point. I've got a query about my record, to drive that dialogue, that improvement in the record, but also ultimately in the outcome. Because if there is something wrong with that solution, wrong with the transcription or whatever that has gone in, that can have an impact. Maybe not right now, but maybe in 5 years' time, when they go to the GP for a different solution, and then they look back and go, oh, well, this happened 5 years ago, and everyone, forgets that, there is no memory that wasn't quite completely accurate at that point in time. It can have a longer term effect on maybe medication that's going to be prescribed to them at some point in the future, based on maybe a symptom they had previously, that kind of thing. And it drives, that same health portal is also available for clinicians to be able to see an end-to-end record of a patient. So when someone presents and they're not someone that person's seen before, they have the ability to look at their entire kind of healthcare record and understand the history of that patient. So it's not just someone turning up with an isolated condition in A&E or in an ambulance. They're able to see the entirety of the record, which enables faster, more effective treatment
Super important.
to them.
Super important. I guess the access to these documents is between the patient and the healthcare
Yeah,
professional, right?
yeah.
Okay. No, this is really interesting too, because just like a month ago, I went to a specialist. I had to change my specialist because the one that I had was even before COVID, and after COVID, it was complicated to get an appointment, blah, blah, blah. So I moved houses in between, and I had to change a specialist. When I went to the new one, they were like, well, I need to know your history. I'm like, what do you mean? Do you have a computer? Can you check my history? And they
Yeah,
were like, I have access to nothing.
yeah.
And
And that's
I was like, I've been in treatment for this for 7 years. You want me
mm,
to start telling you
everything.
everything from 7 years ago, thing by thing? And they were like, sorry, I need you to. And I'm like, this
Yeah.
is crazy.
And that is the reality in most countries. Denmark being an exception, because of the work that they've put into digitalizing that healthcare record, and then making it available to clinicians and patients. And think of the wasted effort that's involved. You've turned up to that specialist appointment. If your record had been available, that clinician would have been able to read that in advance, and actually your
My
appointment would have
experience would
been
have been different.
your experience would have been different, but the the half an hour or whatever that you spent in the clinician's room telling him that story could have been 10 minutes of him reading, and then you've got a more personalized and a more actionable outcome, because he's been able to digest what was going on, and probably think about what he's going to say to you before you've even walked into the room.
Not only that, but the other day I was watching one of these documentaries about a person who had what's the name of these people who want their kids to be sick all the time?
Oh yeah.
Uh,
um
well, I don't remember the name, but anyways, they want their kids to be sick all the time, and it was in the States. What happened is this woman kept moving from one state to the other, so it's the same thing, different specialists. So when she got there, she brought the kid completely sick, and she was like, "Oh, my old specialist told me she had this and this and this, and we did this and that, and." This specialist doesn't have anything, they don't
no,
have access to anything previous.
no.
So they do believe everything this person
Yeah,
is telling them.
yeah.
I feel like these healthcare specialists don't have any power. Like obviously, if it is something different, they can do some tests, they can do whatever to check if it is true. But other than that, they have to believe if this person goes and says like, "Oh no, she's
Yeah.
psychologically impaired or whatever," and she has completely knocked down her kids. You know what I mean? I mean, it's
And I think just going back to what I was talking about earlier in terms of people having more access to their medical data, there is a challenge then that actually you create more burden on the system because you end up with the worried well, who are who are perfectly fine, but they've seen a 0.1% reduction in this, and then they try to get a GP appointment to go. This is my stats just got down
oh
today.
yeah,
What does that mean? What do I do? So I think there is a whole education piece there, but equally, and in other industries, you see a channel shift in terms of how you access health, how you access services, and that could be as simple as a text message or a WhatsApp message that goes into perhaps an AI bot, that might then be able to go, well, actually, yeah, that stat going down by 0.1% is fine. You only need to worry if it goes down by 2%. Um, and that's where we've then got to think about, well, if we're giving citizens access to all this extra data or empowering them, how do we handle those additional queries that start to come? Because at the moment, certainly in the UK, the access to healthcare is generally through an appointment with a GP surgery that usually starts with a phone call to get that appointment. Um, so there's got to be that channel shift in access to
yeah.
inform and to provide reassurance and engagement for citizens as you open up all that data to them.
100%. Well, do you think that now with the rapid evolution of AI and data analytics and automation, do you think there is any opportunity of improving these patient outcomes, or like is there any opportunity? No. I see you doing no with your
Well,
I
so
see
yes,
you doing
there,
no with
there,
your face.
there absolutely is. I
Oh,
think
okay.
I think my hesitation there is
Okay.
that there is a lot of AI, there's a lot of data analytics being used in isolation. And I think it's got to be used in a way that complements the whole system. And yes, having all that data available, around the experiences of other individuals that maybe have similar conditions, and where maybe their condition starts to tail off, and where it then spikes back up, and then being able to perhaps start to predict that has got to have an impact on wellness, on improving outcomes for patients, because we have got to be able to use that data to intercept things earlier, and to make interventions and move to a more preventative healthcare system. The challenge is harnessing that appropriately and using that as decision support for clinicians as opposed to replacing clinician decisions, using that to inform citizens but not scare them. So there's just so many kind of red flags or healthcare warnings that need to come with the use of AI and data analytics. But yes, it absolutely has the ability to push us in the right direction if used correctly and if built on the correct foundations and on sensible data foundations. But back to the point around transparency and quality of data,
Hmm.
if that's not there, the AI and the data is largely not going to drive the outcomes that we want or need it to do in order to really make efficiencies and cost savings and all that kind of stuff to the healthcare systems around the world.
Oh my God, so much to talk about, really. I mean,
We're
we're
barely
more.
scratching the surface here, Maria.
I know, yeah, I know, but we are more half the program, and I don't know. I want to ask you about cultural and
Mm.
operational resistance, because I think that's huge. And many times digital transformation projects fail due to this cultural operational resistance. What are some best practices that you that you have used for successfully implementing new technologies in healthcare or other industry sectors?
I think the biggest thing is bringing the team along. A lot of people go, "We've got a problem. Let's buy some tech. Let's deploy the tech." Um, Deploying tech is part of digitizing the solution. Back to my earlier comment around we like to make sure that we're helping our customers digitalize, and that is not necessarily about putting a tech sticking plaster solution over what might be an old process or a broken process.
Mm-hmm.
And in order to do that, you have to take the people that are part of that journey, so the clinicians, the administrators, and bring them into the team that are deploying the tech. And that is sometimes done as a side of desk project. And I think where I've seen that done really well is where you actually bring that team and you take them out of their day jobs for 3 months, 6 months, 12 months, 24 months, dependent on the duration of the program of change that you're looking at, and allow them to reimagine the process and be part of reimagining that process, and then sponsor and support that back with their peers, then that are responsible for adopting the technology, to say, actually, this is why we're doing it. This is the benefit we're going to get. Yes, this is going to be painful. This is going to be different. But if you take them on that journey, actually, you then get greater adoption. You then get greater compliance with the new process. And you generally then start to realize the business case objectives and outcomes that you thought to achieve at the start. um, Technology programs are people programs,
Mm.
and without the people, you're just you're just creating another problem for the future, basically.
Yeah, I always say that whenever we're working B2B, we're actually working P2P and it's people to people. And that's why, as you
Correct.
say, the important thing is to have the team brought, on board, sorry, not abroad, the team on board and, make them understand how everything is going to be so much better and they will work with you. So,
Absolutely.
yeah. Well, this is going to be the last question, although we could be talking about this for a long time. And I don't want to go before asking you, what do you think are some of the key trends in health tech and digital transformation that you believe will define the next 5 to 10 years?
So I think from a healthcare perspective,
Yeah.
we've got to shift out of this legacy world. Um, there's a lot of conversations going on around, oh, if only we could do this, but we've got this legacy system, we've got our systems that don't talk together, interoperability hasn't been resolved really at a in any healthcare system properly. um we have got to shift to investment in legacy so that we move into an evergreening cycle when it comes to technology. And I think that starts to shift us towards a more modular approach to technology within healthcare systems that allows systems to be switched in and out more frequently. But that requires, a bit like I talked about, us needing a two-speed process for healthcare to shift from reactive to proactive. We've got to have that from a technology perspective in healthcare, where we've got to start investing more in moving off the legacy, as well as investing in the new technology and bringing those two things together, so that in 5, 10 years' time, legacy isn't something that we have to address. It's something that is just addressed as BAU as we go forward. Because I think in nearly every healthcare system, in every health system around the world, you've seen an investment in big programs, in big solutions. And then in 10 years' time, they go back round the boy on, now we need to do a new system again. And we've got to get to that more iterative kind of evergreen type process. And then to go, the other thing that I think is going to be key over the next 5 to 10 years is, how do we really shift from analog to digital and really start to exploit that explosion of data that we've already talked about today, and converging those AI and data solutions into something that really drives insight and change, and harnesses improvement of the healthcare outcomes at their core. That is something we've got to get a grasp of. There is no magic bullet to that, but different healthcare systems are at different stages of maturity with that. I think we're starting to see some interesting stuff starting to come out of the likes of Denmark that are obviously more digitally mature. Then being able to scale that on a larger scale, in some of the larger European geographies, is certainly something that we're starting to drive here in the UK, and in other areas as well, as to how can we start to accelerate that and maybe leapfrog some of those opportunities.
Well, so, well, lots of things, but you talk about shifting towards modular programs,
Yeah.
about being proactive, investing more in technology, um, and working more on AI and data analytics, obviously. So lots of things to do in these 5 to 10 years. I think we need to keep on working.
It's going to be a busy time for everyone that's involved in health tech. Yes, absolutely.
Busy time, busy time. Well, thank you very much for being our guest today. And that's the end of today's show with
You're very
Jamie
welcome. Thank you very
Whysall.
much for having me.
No, really, thank you for being with us. So that's the end of today's show with Jamie Whysall. Please make sure to tune in again to see and or to listen to the next VistaTalk show, where we will be discussing more interesting topics with interesting people from all around